So good evening, everyone. Myself, Santhosh, your StudyMEDIC mentor. So today we'll discuss what to do or how to act if you are given a station in your OSCE about teaching and supervision station. This is most commonly station. Usually we have out of 16, most of the exam, you get 2 stations to perform. So we'll just go through it to make yourself to have each station. So to start with, I'll discuss with a small scenario, which is usually common previous question. This was the question which I got in my last MRCEM exam when I gave OSCE one. So Mr. John, who is 36-year old, and he has got a injury at the top of his finger, right side, mein, and this airway is patent, and there is no other injury sustained to the patient. And your consultant asks you to give a digital block, and you are being told to teach this same station to your junior. Now, this is a common scenario which usually we in common practice to our ED practice also. And this will be the segregation of the skills will be given to you before you enter the scenario, before you enter the room. So now please before entering the room, go through the segregation of the marks which have been given to you, the skills, and then as soon as you have to make your mind set, how much you have to perform and focus on which aspect you have been given to you. So accordingly, you'll be scored inside the room once you go inside the room. Okay. And this was the now block teaching station. Accordingly, I'll give you one more example of what kind of question usually comes in an OSCE. Again, imagine Mr. Alam is a PhD resident who has asked you to teach his adult basic airway management in the ED department, and you have to teach him what and answer whatever the question he has asked. Now, again, for this, again, before you enter the room, you have 1 minute time to go through the scenario. And again, segregation of the marks is very important. As you can see this, you assume it's a teaching station. Still, the marks is much more for the practical skills and the clinical knowledge. So make sure once you enter the room, you have your mindset accordingly to be act before you act. Again, in this kind of scenario, you will be given a manicure usually to perform about low flow oxygen therapy and the high flow oxygen therapy, invasive and the non-invasive ventilation techniques. And this was your basic airway management teaching session. Now, this was the 2 scenario I have given. Now, as I've told you, like in every exam, usually there are minimum 2 stations in your teaching skills. It can be anything. So I'll give you an idea about what are the various teaching skills usually you get in your exam, in your OSCE. Most commonly, now blocks is very common. This nowadays in the recent exams, the now blocks is very common. Usually they go from easy to think, but they can be a difficult like inferior now block also, and the femoral now block also. So you should be ready for that everything. And then the procedures, this is more common. Again, most commonly asked in the exams are back slab application, the arm sling application, Thomas splint, and usually they ask for the central line, the art line also. You should be ready with this procedures also. And then basic airway management, I have given the scenario in the last slide. And the procedural sedition. Now, this is important. This station is coming now commonly being asked in the last recent exam schedules, which you have seen now. What will they do? They give you X-ray and then of the cellular dislocation, and they tell you to perform the same technique and teach or inform to the patient. This is not a junior. They tell to inform same thing to the patient and take consent also. This is again an important aspect of the teaching station only. You will follow the same protocols, which I will tell you in the next slide for this thing also, like teaching to either to your junior or teaching to the patient or taking from the patient consent also. Same format we can apply for both the stations. And then teaching ECG to your junior and teaching acid blood gas analysis to your junior. And then it can be teaching station for the fundoscopy or otoscopy. So this was the routine thing I have given. What are the previously things which have been asked in the previous exam. Now what I will do, any station you get, there is a uniform format how to perform once you go inside the room. So this is fixed. You have to follow the same performance, and the only thing, the procedure will be different, but the format you follow will be the same. So it has brought 3 aspects before you enter the room. That is introduction. That is very important to develop a rapport with your junior or the patient, which you have in your ER room. And then you have to set the learning objectives. That includes entire plus and entire thing about your procedure, which you have to perform. And the end, you have, if you have set the learning objectives for your junior, then at the end, you have to see where his understanding, he has understood everything or not. In that case, you have to recap things for him so that he has a better understanding. Now I'll go one by one in this all 3 aspects. Be patient and listen to me, and you have to follow same thing for the all scenarios. So once you enter the room, You give your introduction. You tell good afternoon, like this is good evening. I am Dr. Santhosh. You easy registrar. And may I know your name and grade, please? Now this grade is important because you have to check his what level he is. How much you have to tell to him, how much he to understand his understandability. Also, you have to know its grade. That's why you better to ask his grade, whether it's at SR level, junior level, and what grade level he is. And then once he tells his designation or grade, you tell him, nice to meet you. You have to develop a rapport with him. And then you have to sell ki I believe you have something to discuss with me regarding anything. Just for take example, it is a no block station. So you can tell him ki you have something to discuss with me regarding your digital no block. And then now before you start with the procedure, you have to just understand ki how much he know the things and how deep you have to go in teaching station, because the time this is routinely we do in clinical practice also. Before you teach to any of our junior, we ask their understanding levels or how much they know. So better to ask in the introduction session only ki how much do you know so far about the topic. Maybe he might be knowing lots of the things. He want to know something specific only. You have to tell that only. You don't have to tell everything which he knows. And there should be no repetition. This is a good teaching format. That's why it is better to ask anything special you want to know. And to start with, you can tell him how much clinically important this topic it is. Like you can he has developed, so he develops interest in the topic. So this was the introduction session. Now, once you have given introduction, you have built a good rapport with your junior. Then now you start about the learning objectives and the coming to the procedure now. To set up a learning objective for any procedure like kind of now block, in that case, we have to like this is easy for segregation. Like any procedure you tell, you have to do something which is done before the procedure, during the procedure, and after the procedure. This is good format for us to once you present that case in the inside the room. If you're getting panic, you remember this kind of thing. You have to cover this all points. Then it makes you to perform easy and smoother. Like we'll go one by one. Like if we talk about before the procedure. So if you are doing any procedure, what is the before the procedure is the things to be considered to tell you the junior, like indication. You should tell the indication of this procedure and just be brief, like major 2 or 3 indications you have to tell, and then you tell about the contraindication of the procedures and can be the probable complication of the procedure. That is important. That is the patient right, junior right. They have to know before doing any procedure. And then once you have told about complication, focus on how to avoid complications. That is also important. Like if you are doing any nerve blocks, so tell them how can you avoid nerve blocks. Like you can tell them like you have to use appropriate doses of the drug, and then you have to use ultrasound machine while doing the procedure. That can avoid the complication. And then if you know any alternatives of the any procedure, you should tell that also. It's not mandatory in all cases, but if you have any alternative for the procedure, you should tell the junior while teaching this. Now coming to during the procedure, during the procedure, what you have to do? Preparation. Now preparation are 3 things are there: preparation for the doctor, preparation for the patient, and the equipments. For the doctor, you tell them to wash your hand and wear PP. Now for the patient, position is very important. After the procedure, positioning, consent is also again important. You have to tell the junior to take proper consent. And once you have done the preparation for the doctor and the patient, next is equipments. You have to make sure all things which are required for the equipments, you mobilize and you tell them to check whether it is there or not before the procedure. Okay. Now, once you have done your preparation, now it comes to the procedure step. You have to tell all steps slowly in a very precise way. Now, thing is that most of the junior, what they do mistake during teaching the procedure, they go in deep. Don't get biased. You have to go very concise way and you don't miss all the steps also. Okay. Now, once you have done all these procedure steps, now thing is that you have to tell your junior or your patient after the procedure, what are the important aspects. Now, post-procedure management, like you have done if you have given the nerve block, now something you have to done, like you have to do in injection tetanus toxoid or antibody coverage or dressing, or it can be some advice also, like whether you are admitting the patient or discharging the patient, whether you need to do some X-ray also before disposing the patient. And once you have decided for disposition, now follow up the patient. You have to send the patient with printed leaflet. This is the medicine you have to take, and you have to come back and this and this the OPD which is required, so that the patient is very clear what he has to do. Now, once you have explained this everything also, now important aspect which is usually miss is in teaching is documentation. You have to tell your junior whatever you have told to the patient, whatever you have done the procedure, you have to document each and everything which we have done. Okay, this is which usually this is missed by most of the juniors while teaching in the station. So don't miss to document everything what you have told. Now, during this procedure, what you have explained them, it's better to develop a good rapport during with the junior. You ask about understandability. You have to ask at every aspect how much you have understood. Are you understanding things or not? This is to make a rapport. Or as you can ask straightforward questions also, like you can tell in the between, what do you think? What is the next step also? That makes you and your junior rapport and the understandability that you are very sure, yeah, understanding the things. And the examiner who is judging you, he understands you know the way of teaching. This is basically routine format in teaching. Now learning objectives have been sent. Now thing is about third aspect I told about recap. So I told about checking understandability of checking the thing understandability, how much you have understood. So in between, you can ask in the starting, you can ask if you have forgot to ask in between or in the starting, you and the end also you can understand. I can ask and check understandability, how much you have understood. You can ask him very clearly, do you want to make me to repeat anything, or if you have not understood, we can repeat also. Once he says he have understood everything, then you can ask him if you have any questions to repeat. Now, this is important aspect. Any question, most of the stations which I have been in the given, we have given our exam, we have noticed most of the places where they are the person who is there, who's acting as a junior, he has been given some routine format of the question. So if you don't ask, if you have any question, they will not ask you. So to go, score good, we have to clear all this question or doubt, whatever he has. That will be primarily said by the examiner. So be careful to ask. If you don't ask, he will not ask the question also. Okay, so we will usually ask whatever the questions or in doubts the junior doctor has have, then you have to answer all questions. Okay, and then once he tells ki I don't have any, mostly if he tells ki I don't have any question answer, then in that case you are going good with the scenario. This is the routine practice, which is our personal experience. And then still you can tell ki I will update you with some website or videos that will make you understand more about whatever I have taught. And you can tell them I can share with you after the session. And once if you have time, tell your junior to encourage him to summarize the things. If you have time, most of the cases you don't have time before you reach at this level of the station, but still if you have time, you can tell to summarize, because once you start summarizing, so most of the things are understood, the station has went well, and the most of the time by this time the bell rings and you have to go out of the room. Okay, but do this before you have done all the basic steps of teaching, which I have told them: introduction and the learning objectives, and third was the recap. If you cover all these 3 points slowly, one by one, and you keep in the mind, you have to ask about during the procedure, after the procedure, and before the procedure, then all the things of all the aspects of the procedure can be covered during this. You don't miss anything. And the brief about the procedure types, how to do the procedure, that is very important, that you fix, and rest format is very same. So follow this format in every case. Now stick to the time. Why I have told them, once you come to the topic of teaching the steps of the procedure, in that case, most of the juniors do mistake. They go in detail. So don't go in detail. Stick to the time. So don't get lost anywhere. Like you have been, if you started the procedure, you're going. Just don't do that, because you lose your time, because you have to cover points after the procedure also. And the station should be covered only when you finish all the topics. Then only you get a good score in the teaching station. Now, this is the very common thing I have been asked by my junior students. Like they usually ask, sir, ki at times we have got a like kind of bouncer station, which I don't know anything about the station. So I was very blank and I was sitting, I didn't speak anything. Now, this you should not do. Assume you are in an exam, you have 16 stations to go, and you got a station which you don't know how to, you don't know the steps of procedure. But what you follow, what I have taught you. So go through the routine steps, go through the things. At least we can talk about indication, contraindication, complication, even if I don't know procedure, don't know about the exact procedure, how to perform. You talk about post-procedure management and all, you talk about teaching, you talk about understandability, you talk about, I'll share you the materials, what is your doubts. Even if you cover this thing also, like that shows you're confident. In that case, when you got a bouncer station, in that case, the stay calm, cool and confident, and follow the general approach, which I have told you. This shows your confidence level. If you act has a good confident level, even if the station is not known to you, so the examiner thinks ki, okay, you can be a good candidate for clearing, and you are a good person doing your teaching, so you have a good teaching skills in that case. So in that case, this is very important to stay calm and show your confidence. Don't show ki I don't know anything. So that's why this slide I have made you this 3 slides. Stick to the slides in any teaching station, you will score at least 6, even if you don't know the station. And if you perform well, you can go to 8 and 9 also. So always follow this format which I have told you. You don't miss anything, at least in the teaching station. So now again, to be a good scorer, now you have now how to reach at a good level, where in OSCE station you go and come out, with the confidence. This comes only after practice. Now I have told you these 3 important slides. So practice with this important 3 slides with your junior or your colleague. Even if you are alone, practice with the pillow, and practice and go through all the measures procedure which I have told you, starting from the ring block to the fundoscopy otoscopy. If you practice 3 times, 4 times, 5 times, so this teaching station is very easy at the end of the year exam, and you are near end of the exam. So you feel confident. So any station, if any bouncer station also, you stay confident and then you get good score marks. So practice, but make sure whenever you practice, no, someone should supervise you. That's why you should know your mistake, where you're lacking, which things you should not cover. So that will be better. So once you practice and let the other junior practice, this makes you score good in your OSCE exam, and you all will pass if you practice and you guys study with us then. Thank you. So I'll meet you soon with the next session of a Teaching Good Station, and that will help you out to make you with the OSCE clearance very easy. So stay with us in StudyMEDIC, and thank you all.